How do antifungal drugs interact with statin medication? Imagine battling two health issues at once: high cholesterol and a fungal infection. When you need both treatments, understanding how these medicines work together becomes really important. Statins are drugs used to lower cholesterol levels by blocking an enzyme in the liver called HMG-CoA reductase. This enzyme helps produce cholesterol, so stopping it reduces blood cholesterol. Antifungal drugs, especially azoles like fluconazole, itraconazole, and voriconazole, target fungi by blocking a different enzyme called 14-alpha-demethylase. This enzyme helps fungi make ergosterol, a key part of their cell membranes. Both drug types interfere with making sterols, but in different ways and in different organisms. When these drugs are taken together, two main types of interactions can happen. The first is pharmacodynamic, which relates to how the drugs affect the body and each other's targets. Some studies suggest that combining statins and azoles might make the antifungal effect stronger because both disrupt sterol production. But this is mostly seen in lab tests and isn't a common reason to combine these drugs in real life. The second and more important interaction is pharmacokinetic. Many statins like simvastatin, atorvastatin, and lovastatin are broken down in the liver by an enzyme called CYP3A4. Azole antifungals, especially itraconazole, ketoconazole, and posaconazole, strongly block this enzyme. When these azoles are used with statins that depend on CYP3A4, the statins stay in the body longer and at higher levels. This increases the chance of side effects, especially muscle damage. Muscle pain, weakness, and in rare cases, a serious condition called rhabdomyolysis can occur. Fluconazole is a weaker CYP3A4 inhibitor, but muscle injury has still been reported when combined with statins. Voriconazole also inhibits CYP3A4, so similar risks apply. Not all statins are affected equally. Pravastatin and rosuvastatin are processed differently and are less likely to interact with azole antifungals. That makes them safer choices if you need antifungal treatment while on statins. For patients with high cholesterol who need antifungal drugs, doctors often recommend switching to pravastatin or rosuvastatin if a strong CYP3A4 inhibiting azole is necessary. If switching isn't possible, close monitoring for muscle pain or weakness is essential. Sometimes, doctors might reduce the statin dose or temporarily stop it during antifungal therapy to lower the risk of muscle injury. Understanding these interactions helps keep you safe. The main concern is that certain antifungal drugs can cause statins to build up in your system, leading to muscle problems. Choosing the right statin or adjusting doses can prevent these issues. Always talk with your healthcare provider about your medications. They can help decide the best approach for managing both high cholesterol and fungal infections without risking side effects.